Welcome, everyone, to another episode of Ask Dr. Leila podcast. Today, we have our specialist endodontist, Dr. Anu, and welcome.
Hi, thank you. Thank you, Dr. Leila. I'm thrilled to be here and appreciated that I'm invited to this platform. I would love to stop for a minute if you allow me, Dr. Leila. As you guys know, I belong to Spain, specifically to Valencia. And I want to show our support from LHDM Clinic to all those people that have been affected, unfortunately, due to these catastrophic floods called Dana. So from here, from Dubai, from LSDM, all our love and support to these people who have been missing. They've lost lots of things due to the floods and still recovering. And I guess it will take time. So from here, our love.
Our thoughts and prayers are with them, and we're sending them all our strength. And to today's topic, how the oral mouth reflects what's happening in our body, Dr. Anu. Could you enlighten us on this?
Yes, people think that dentists, we only look into teeth and gums, but that's not true because from the mouth, we have this getaway to look into the body, and that can give the dentist a lot of idea about our lifestyle and our habits.
Amazing. So I would imagine having a thorough examination could give us and our patients so much insight.
Yes. It's something we need to consider. It's something that when you guys sit in the chair, you guys think that we are only looking into the gums, but there are several things that we can discover just going into details on those things.
Absolutely. And can you tell us a bit about early intervention in children?
Yes, so it's very important to get a consultation with the pediatric dentist, who's the specialist who's taking care, because the mouth organ, it's very important, it's very critical, and it's something in which we can work from early stages.
And it's the starting point of our digestive system.
Yes. So specifically, if we see a patient who has a bad breath, we can assume that he's going through some struggle into the digestion system.
And talking about pediatric dentistry, we should say a big hello to Dr. Safa, our pediatric dentist, and to all the parents. If you have kiddos, please do have Dr. Safa see them. You will love her.
She's amazing.
How do you think we can help better understand the connection between the mouth and the body?
See, the microbes in the mouth, they have a connection to the bloodstream. So whenever there is a bacteria, can go through the canal, through the bleedy gums, or when there is an open tooth that requires a root canal.
Absolutely. And talking about root canals, I know now more and more everyone's hearing that root canals are bad. And I know this is what we've been doing for eons. How can you help us understand what do you do, for example? Let's start there when you do a root canal treatment so that people don't fear that lingering bacteria.
See, it's a very controversial topic. I tag myself as a conservative dentist. I'm a root canal specialist, definitely. And my specialty has been always an enigma. So depending on the case, definitely what we have introduced, as long as the world is becoming much more biological and holistic, we are introducing something called ozone water. We are lucky to mention that in our clinic, we have all the technologies and all the materials that can help us to create this. So this kind of gas, which gets converted into ozone water, helps us to disinfect the canals through the bacteria who are sitting in that tooth. So definitely we have introduced this, and studies are being happen. We can't say 100% disinfect the canal, but at least if we know that something is helping us to go in a better track, why not?
Absolutely.
Why
And
not?
I do IV ozone weekly, which is it oxygenates the cells of my body, which we now know is so important, and it's anti-aging. So I'll do anything for anti-aging. So that's an additional benefit that people can do, but definitely using ozone in your root canal systems. And I'm sure there are points where you decide, no, this is not good for root canal therapy, or it's already been treated and it's a chronic infection. It's better
Exactly.
to remove and place an implant.
Definitely.
Yeah.
That's where our diagnosis has to be very thorough, starting from oral health, going through everything and the condition of the patient.
Absolutely. What conditions they have systemically. Looking at the gums, back to the oral health and the overall health, what can we detect from gums?
It's very funny, but seeing just at the gums, we can know if the patient is flossing or not flossing, is following our rules or not. We can even detect some erosions and cavities, so we know that there is an imbalance in the sugar levels. We can even point out if the patient has diabetes. So there are several things we can discover just by looking into the mouth.
I've had instances where they were really bleeding a lot, and I asked the patient to go do a blood test.
Yes, it's very important. There is, if I'm not wrong, there is a value in the blood test called ECR, where the red cells, I mean, if they show a high value, that's the time we can figure out there is an inflammation, an infection, and sometimes it's silent. So from a simple blood test, we can also discover any pathology that the patient can go through.
Exactly. And from the stains of the mouth inside the teeth, we know if they're more cigarette smokers or if it's the coffee tea.
Correct.
And then we can talk about other holistic things that usually we just generally do talk about with our patients. And thumb sucking, what can you tell us about that? How do we detect it?
According to the shape or the position of the jaw, we can figure out if the patient is fucking her thumb or not. It's something that we can figure out. Yeah. That would be a perfect moment to refer to the orthodontist and take care in early stages if the patient is a kid.
You have mentioned here right or left-handed brushing
Yeah.
patterns. Can you tell without,
It's very funny. I mean, if we are right-handed brushers, we definitely brush much better the left side. And it's reverse, we can also see. So it's a fun fact.
so you find calculus on the
Yeah,
opposing
on the
side.
opposite side.
So there are more critical findings that you've mentioned that help our patients understand potential deficiencies. Can you elaborate on that?
I saw many patients that they face dry mouth. Usually, if there's dry mouth, as I said before, they have an imbalance in the level of the sugar, so they are more prone on cavities. Patients who have cracks in the tongue area indicates that they are low in iron. Some cracks at the level of the mouth can indicate that there is a lack of vitamin B2. And there are many more. I mean, when you find someone with dry lips, we always run putting some Vaseline, but the problem is deep enough. It's you're lacking of omega-3. So there are several things that you can dismiss from a quick checkup.
That is really amazing.
Yeah.
And there's ulcers.
Yes.
What is that a lack of?
Ulcers usually is related to immunity. So we need to have a look. If a patient has recurrent ulcers, we really need to check on a blood test to investigate what's the reason behind, because the patient can have an autoimmune disease.
Yes.
Right? We can even spot it with some red soreness related to Crohn's disease, or we can even have white lines at the mouth that
Lichen
can be a
planus.
lichen planus. Yeah.
Yes.
So these are things that probably patient cannot tell, but if we are professionals, we can detect in an early stage.
Absolutely. And for all the pregnant women out there or to be moms, pregnancy brings a lot of imbalances in the hormones.
Exactly, exactly. There is, in fact, one benign tumor called granuloma. And usually women in this stage, by the way, a pregnant woman, it's not a disease, it's a medical status. We have to clarify this because they're very reluctant to come to our dental chair. And I do collaborate with many gynecologists, so I invite them to come just for a quick and early checkup, because when we detect this kind of granuloma, we just need to calm down them and tell them once they deliver, for sure, it will go away.
Correct. And on the other spectrum, for older women, what do we detect?
If we take an X-ray, we can help them to detect an early stage of osteoporosis. So it's also very helpful for them.
Amazing. I think you mentioned this already, autoimmune diseases like Crohn's disease.
Yes.
But this is really important. I mean, to catch certain diseases before it's widespread in our body and we have to get, medical attention for, I think it's incredible what dentists can locate inside your mouth.
Yes.
As simple as that, basically.
Exactly. Exactly.
And there's one very important aspect I want to talk about as a parent. Children in this day and age have to deal with a lot of bullying and eating disorders. What can we detect from that?
Usually when a patient comes to our dental chair and we appreciate some erosions at the palatal teeth of the anterior arch, we can guess that there are some acid from the stomach which is coming through the oral cavity.
Amazing. And here at LHDM, we're trying to be more and more holistic. And by having Dr. Parviz Rashvan as part of our team, I think you can attest that it has really helped
Yes.
enlighten all of us
Exactly. I mean,
dentists.
the message I would like to give to our patients is we are not only a dental clinic, we are a medical center, and we are here to help and support our patients and bring happiness into every family, because it's very important to take care of our lifestyle.
Thank you, Dr. Anu, for this enlightening conversation.
Thank you, Dr. Leila, and I hope this entire information has helped to all our listeners, and hopefully see you soon.
I'm sure it has. And until next time, everyone, stay safe, and we'll see you next week.